sure that you. Wonderful. So thank you so much. Our new quarterly program, Ethics Cafe, is an opportunity for us to really think and dive deeply into our code of ethics. It's especially exciting because we have a new code of ethics that's coming. You're going to get to hear all about that. And we're working to coordinate and partner with our other interdisciplinary colleagues so that we can work to ensure ethics across the province. But let us take a few moments first to have a moment to acknowledge this land. I want to invite you to take a moment to look outside, take a deep breath, and please join me in our land acknowledgement. Please use the chat to introduce yourself and acknowledge the land where you are located. If you do not know the name, the Indigenous Mi'kmaq land name for where you're located, you are invited to use Google to do so. So for example, I am located in Cape Breton. So I am speaking to you actually from Unama'ki. And really the Nova Scotia College of Social Workers, we are in Mi'kmaq. And this is the ancestral and unceded territory of the Mi'kmaq, whose inherent rights were recognized in the peace and friendship treaties that were signed from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between nations. The treaties were later reaffirmed by Canada in Section 35 of the Constitution Act in 1982, and they remain active to this day. The Nova Scotia College of Social Workers joins our members and our communities in the necessary labor of reconciliation. We are so grateful to live and work together as treaty people in Mi'kmaq. So let us take this moment for gratitude. Take a moment, take a deep breath, and allow that gratitude to fill you for this beautiful land, for the amazingly wise and brave Mi'kmaq leaders and communities who have cared for this land and continue to care for and advocate for it. Let us take this moment to affirm our commitment to joining in the important work of decolonization, which has affected so many across the planet. Let us work to decolonize ourselves, our practice, and this community that we share by working for justice for all human beings as an expression of our gratitude, as well as an expression of the land-based teachings and values that we all must begin to learn and honor. Please think of the lands, territories, and Indigenous peoples who lived and continue to live within these lands, and how each of us, individually and as a collective body of social workers, can hold ourselves accountable to reconciliation with Indigenous peoples here and across Turtle Island. We are all treaty peoples. Laliu. Thank you all. And I'm so incredibly excited because we have some awesome people joining us. You hopefully know me, Anne, your Nova Scotia College of Social Workers professional practice and advocacy consultant. And I'm assuming you know our awesome, fearless, brave leader, Alex Stratford, who is our executive director and our registrar. And we also have Lauren Matheson, who is the Community Development and Outreach Officer for the Canadian Centre of Policy Alternatives, but also is chair of our ethics process at Nova Scotia College of Social Workers. And so grateful to Marika Warren, who is joining us from DAL and who oversees bioethics and medical ethics as the network ethicist for the Nova Scotia Health Ethics Network. We're going to have a chance to learn more about her, but obviously, we know that ethics is not just something that our profession cares about, but is also something that needs to govern how we work with other disciplines in service of those people we are caring for and caring with. And so being able to work effectively with Marika and with the ethics consultation processes that are happening in our health systems can be a really important strategy for us to work to effect change, to do advocacy in order to ensure more ethical systems within which we work. So we're going to have a chance to talk a little more, but I also want to take this moment to express deep gratitude to Amber Gallant, whose BSW practicum this summer focused on helping us develop our process. So a lot of what Lauren is going to be sharing came from work that was developed in partnership with Amber. So very grateful to her, and also a gentle call out if anyone else has practicum students that they know of who are looking. I love practicum students. So with that, I'm going to stop share and I'm going to turn it over to Alec so that Alec can say a few words about our own approach to ethics with the Nova Scotia College of Social Work.
Hi, everyone. So grateful to be with you here today. I was chuckling to myself, and as you said that you are willing to take practicum students, as I see our friend Rose is online. There she goes, making a comment, who coordinates practicums from Dal. So I imagine that Rose will be reaching out very soon. I'm happy to be with you all today to continue our conversation around ethics, which of course is primary to the role that the college plays in Nova Scotia. And it's important that we, of course, ground ourselves in our values, beliefs, and again, our framework for practice, which is grounded in our National Code of Ethics. When we think about codes, ultimately, they serve a number of purposes, some of which I've just mentioned, but to social work, they are a foundational document that outline our pedagogy, that outline, again, our worldview in many ways. They are aspirational, for sure, but they also ground us in the expectations of the profession and what the public can expect to receive from social workers as well. This is why it's so troubling, again, in 2022, as we start to reflect on our core values as a profession, which of course align with egalitarianism, human rights, the pursuit of social justice. But as Merlinda Weinberg has pointed out, when we examine the vehicles for evaluating ethics, such as our code of ethics and our decision-making tools, there's a striking absence of the word and of the ideas of racism within them. For instance, the CSW, the current version, the CSW Code of Ethics, while there's recognition of diversity and one mention of discrimination, a search for the term racism does not reveal a single mention, nor does reconciliation, colonialism. These words are strikingly absent currently from our core document, which is meant to be aspirational and meant to ground our foundational practice. Of course, we know that race does not biologically exist, yet how we identify with race is so powerful. It influences our experiences, shapes our lives. In a society that privileges white people and whiteness, racist ideas are considered normal throughout our media, culture, social systems, and institutions. Historically, racist views justify the unfair treatment and oppression of Indigenous and Black people, including, of course, the projects designed to displace and dispossess people of power, including colonialism, enslavement, segregation, and internment. We can be led to believe that racism is only about individual mindsets and actions, yet racist policies also contribute to our polarization. While individual choices are damaging, racist ideas and policy have a widespread impact by threatening the equity of our systems and fairness of our institutions. So to create a more equal society, we must commit ourselves to making unbiased choices and being anti-racist in all aspects of our lives. Now, in social work practice, Indigenous and Black scholars and activists have been researching and writing about systemic racism in social work for at least the past 6 decades. And there are many examples of white supremacy in our practice, particularly where whiteness is normalized and seen as aspirational. scholars and activists have demonstrated how the architecture of racism in the social work profession is embedded in our practice, in our research, and in our education. The Supreme Court of Canada has also included that it's difficult to overstate the importance in our society, the proper regulation of our learned professions. And the primary purpose and establishment of self-governing professions, like ourselves here in Nova Scotia, is protection of the public and public safety. And this is achieved by ensuring that we have qualified and competent practitioners and that there is conformity to the values and the standards of the profession. Yet in social work practice, our standards and our ethics of professional conduct stem from notions of white professionalism and boundaries and community. There's much research on this, but one example would be Harjeet Kaur Badwell, who writes in Can I Be a Good Social Worker? Racialized workers narrate their experience with racism in everyday practice, that even the concept of good practice stems from a white worldview. Social work centering of whiteness in our standards of practice then finds itself in various areas of our practice. For instance, in mental health, we are continually pushed to rely on the DSM-5 as a way to diagnose and treat mental health issues. And of course, with a big lack of focus on the social and political and economic social factors that impact mental health. And the DSM itself has been identified as having social constructions of mental illness that are done through dominant definitions of what is normal, and there's evidence of stereotypical notions of race. In child welfare, we continue to see an overrepresentation of Black and Indigenous children in care. This overrepresentation is caused by what our esteemed colleague Robert Wright names as the child protection system's Eurocentric definitions of what family is and what parenting is, and discrimination that occurs against Black and Indigenous families for not living up to a white model of family. It is our role as regulators to protect the public. And so what this means is assessing how our practice reinforces white supremacy, causing harm to many Canadians. It is our core function to constantly reflect and look upon how our grounding tools are perpetuating those ideas of white supremacy, leading to harmful practices. So for at least 3 years now, we were delayed because of the pandemic. We've been working with our national partners to revamp our foundational document, particularly with two specific purposes. One is coming out of an apology from the CSW and all of our federation partners on social workers' role in the colonial project of residential schools in the 60s Scoop. That we commit ourselves to truth and reconciliation. And that commitment needs to find itself specifically in our grounding and foundational document. And of course, along those same lines, a clear and established focus on anti-racism. And so over the last 3 years, there's been a national project in consultation with Indigenous communities, with social workers, and with other community partners to redefine that code of ethics. We're getting close to a final product. There have been surveys out, both sent from the CSW as well as from our college and our newsletter as we get closer to launching it. I can say that there's a much more of a collective feel to it. Demands and priorities around reconciliation and anti-racism work, as well as a continued commitment to social justice, egalitarian, and human rights. So as we work towards the spring and as we work to the CASW solidifying that document, then we as Nova Scotia social workers will have the opportunity to determine if we are going to adopt the Code of Ethics here as well, which of course will inform our practice and our standards moving forward into the future to hopefully better practice and practice that aligns with reconciliation and anti-racism. Thanks, Ed, for the opportunity to speak on this, and I think we'll have more conversations and discussion as the hour unfolds.
Thank you so very much, and I hope that everyone has checked their email to provide some input on our new Code of Ethics. And with that, it is my great pleasure to introduce Lauren to you all, who's going to share a little bit about our process that we have been working to develop.
Oh, good morning, everyone. I'm going to share a PowerPoint. Just let me know if it doesn't pop up right away. So my name is Lauren Matheson, and I'm following up Alex talk about what's going on, some of the changes that have been in the process. I'm going to switch gears and talk a little bit about the ethics consultation development process that is specifically we've been working on in the Nova Scotia College of Social Workers through the Professional Development Committee, as well as like a smaller ethics committee. And so we're really in this information gathering stage. And so the overall goal was to develop a consultation that can best support members, particularly around ethical conflicts and challenging decisions. So currently, when members have ethical queries and concerns, the two existing routes that the college offers is the existing tool, which is the ethical decision-making tool online. That is it's up all the time, as well as one-on-one connect with Anne or Alec. And so the process itself was to develop more of a tracked consultation reviewed by a committee in order to also help the college understand what are the themes and concerns coming up to be better able to provide advocacy, education, or any other interventions required to support members. And so we started with, it's not moving forward. There we go. We started with a review of social work colleges across Turtle Island, New Zealand, and Australia. So we contacted 11 organizations, communicated with 10 through either email or an interview, a Zoom Skype process. And this was led with Amber Gallant. So many thanks to Amber, as Anne indicated. We asked them questions along the lines of what do you do for ethics consultation? Do you have a consultation? What are some of the pros and cons, your learnings? Any information you want to give us, we'll take, type thing. And basically we found two findings. Most organizations offer tools and consultation. So the tools are similar to the ethical decision-making tool that's on the Nova Scotia College's website. And they are an approach to handle considerations that ranged from, what's in the code of ethics? Are there other educational resources? You don't really need a consult, but just a redirecting back to educational tools. Other colleges highly recommended tools such as continuing competency programs and annual ethics trainings that were provided by the college. And those would be like 1 or 2 times a year, similar to like a conference or a cafe like we're doing today. And then an online e-learning platform with ethics modules that are accessible all the time, 24/7 online, and then are integrated into the professional development hours for the year for members. The other piece is the consultation itself. So similarly, there was examples of consultation where a point person with the college, a member would reach out and they would just do the one-on-one, or there was an actual committee outside of the point person that was either staff members or volunteers that queries would go to. And the committee itself, they would either meet with the member that was asking for advice, or they would discuss and bring back basically observations. And in most instances, to get into the consultation phase, there was the point person at the college that would do a bit of like a quote unquote screening. Some people had actual screening forms, others it was more informal, but overall they were looking to understand, okay, is this an ethical query? Is this a workplace conflict? Is this a legal matter? Or is this a scope and standards of practice issue? And having that kind of beginning to the consultation process to know best how to support the members. So we have a very large document that lists out all of the different tools and who does what and who has a consultation, but these are just the findings we'll share today. And then from what we learned, we developed just this small chart that is a potential of what a consultation process could look like. And I'll just remind that this is still in the information gathering phase. This doesn't exist. This can change. And this is kind of if using models from the review that we did, integrating the majority of the recommendations that came out of the colleges. So an example on the left, can you see so there's the NSCSW staff receives a request. And then there's one of 4 routes, one-on-one consult, meeting with an ethics group, NSHA IWK referral, so it'd be a community consult, like similar to meeting, you'll meet Marika in a moment. And then, or kind of the bottom one is tools, right? So refer to professional standards. And then in line with the hope of the colleges, in terms of the nitty gritty, which of course is not developed, is anonymous tracking. What's the turnaround? What does the support look like? Et cetera. And so where we are right now, again, information gathering, and then also it's really the feedback point from professional standards committee and members, and then really the next steps are deciding factors. And those we're not in number 2, we're not really even in number 1. We're like moving into number 1. And so, and also general members as well, letting people know that the college is interested in developing a consultation process and is starting these review processes. The biggest piece of feedback we received, and I'm going to stop soon, is that the ethics committee, if you're developing an ethics committee, is to have at least 50% of the committee be traditionally excluded individuals, so Indigenous and African Nova Scotian individuals in the context of Nova Scotia. So that was a real push from the college, and that is in line with Alec was discussing before, just changes being made to the ethics documents. So this itself isn't discussing, what I just presented isn't discussing the nitty gritty of the ethics documents, more so what would a framework work look like for a consultation process. So if this is interesting, if you have more questions, if you want to learn more, please reach out to N, and I will stop talking now.
Thank you so very much, Lauren, for all of your hard work and kind of summarizing that. As you can see, we are in the process of trying to create new processes. This is something that we've done pretty much since Alec arrived, and building new processes for social workers to really implement our values. I did want to make one quick comment on Lauren's component. Is this process that Lauren described is also the same process that our professional development committee is doing, for example, on building policies that are grounded in best practices amongst many other approaches. And so we did wind up talking to the BC College of Social Workers through the professional development committees, trying to figure out auditing or verification, or how do we go about creating and confirming our professional development, which is vaguely related to the topic we will soon be discussing. So without further ado, so excited. Marika's been just such an awesome collaborative partner. Marika, please help everyone understand what you do, how what you do is maybe different than what we do, and how we could potentially partner.
Fantastic. Well, thank you so much to Anne and the college for the opportunity to chat today. I love talking to social workers and find the conversation is never predictable and it is never short, but that's the sort of thing that I enjoy. So I'm looking forward to talking with everyone today. And I have my notes on the screen to my right. So if you see me looking away, it's not a sign of deception, but just that I need to make sure that I'm covering all the points that I have for myself. And I've also gone rogue and decided to be PowerPointless because I'm actually more concise without them. And so I hope the background is sufficiently interesting to bridge any boring parts in the words. So as mentioned, my name is Marika Warren, and I work as the network ethicist for the Nova Scotia Health Ethics Network, or NSCN, and that provides ethics support to Nova Scotia Health, the Nova Scotia Department of Health and Wellness, and IWK Health, which for folks outside of Nova Scotia is the Tertiary Women and Children's Hospital for the Maritime region. Although I'm still, after 15 years in the role, not always entirely clear on the Maritime Atlantic distinction. So my apologies if I've gotten that wrong to anyone who's at IWK. So NSCN is one of the ethics collaborations that are housed at the Dalhousie Department of Bioethics, but it is oriented toward providing ethics support throughout the province. And a lot of the focus of my work has actually been on ethics needs outside of Central Zone, which is sort of Halifax and environs. I've been in this role, as I said, for almost 15 years now, but in a lot of ways, I still feel like I'm learning a lot. As I mentioned in the introduction, I grew up in Treaty 6 territory, and so still getting a sense of what is unique and wonderful about Nova Scotia, and then how to take that on board as we're responding to ethics questions as they arise in healthcare. My disciplinary training is in philosophy, and the focus of my PhD work was on disability rights. So that hopefully gives you a sort of a sense of some of the orientation that I bring generally to doing this work. So my plan is to just give you sort of a brief overview of the sort of ethics support work that I do, and then give a sort of quick story of how I came to be here today, and then we're going to dive into some specific scenarios that my experience has shown me that those are where we really get some really rich discussion, and as folks work together around challenging questions. So, and this is going to pick up on things that came up in Lauren's and Alex's presentations as well. So there's going to be some nice red threads here. But in terms of ethics support, when we think about that in Nova Scotia, our goal is to build capacity and confidence in those who are facing ethical challenges in their daily work. And for me, it really is an emphasis on that confidence piece, more so than the capacity, because of course, ethical issues arise in healthcare all the time. And healthcare providers are generally very capable of dealing with most of the questions that arise in the context of day-to-day practice. And so generally ethics support is only called in when everything else has been tried and found to be ineffective. So sometimes I feel like it's almost a matter of calling for ethics support when ethics couldn't possibly make things any worse than they already are. And so we do respond to those sort of specific challenges and questions. And again, it's generally the really naughty, really difficult challenges that we're asked to provide support with. But with that capacity building orientation generally, we try and do a lot of sort of preventive work upstream as well. So including developing a number of resources that are available on the NSCN website for whoever wants to access them, as well as really looking to focus on some of the education pieces and trying to anticipate where needs might arise in response to, for example, policy changes and things like that. So that, again, so that folks feel that they're supported, at the time when they're facing a challenge, as opposed to sort of getting into a challenging situation and feeling like, I don't know what to do. Although we're also there as a support for that as well. So in terms of the work that we do, the support work falls into sort of four main buckets. So there's an ethics education piece, clinical ethics consultation, which might be sort of what you're most familiar with or what comes to mind first when you think about ethics support, policy development and review, and then organizational ethics consultations. So these are all interconnected. So again, to link in with some of what Lauren identified there on, how do we best respond, and recognizing that themes that arise in a clinical ethics consultation might then lead to an organizational ethics consult, or work on policy might lead to education sessions, or education sessions might then plant seeds that lead to clinical or organizational ethics consultations. And so, in that support work, we really try and identify those themes and work proactively to address them, and in a sort of comprehensive way again. And part of the point of having the network that involves all the players in the Nova Scotia healthcare system is to sort of make sure everyone's sort of singing off the same song sheet when we're seeing common trends and themes come up. So, at base, ethical questions really boil down to trying to decide how we treat each other. And again, whether that be directly in a one-on-one interaction or a team, family, team, patient interaction, or indirectly through our policies, through the way we design our systems, through the way we allocate our resources. But there are different types of questions, and those give rise to a variety of different ethics support needs. So when we're providing ethics support, we're trying to be flexible and responsive. So figure out what the need is. And sometimes there's a journey from sort of an initial question where someone is feeling uneasy or just something isn't sitting right, to sort of how do we respond to that in a way that really addresses the root of that concern. And we take a process orientation to it as well. So our goal is not to come in with the answer or even a range of answers, which is often very disappointing for requesters, who are in a complex situation that's been, frustrating for a long time, and they're hoping that someone will, have the answer that will sort things out. And unfortunately, ethics doesn't come in with that. However, we hope that we can, provide a well-grounded process that supports the requester in using values to arrive at decisions that address the concerns, again, about how someone is being treated in an interaction in ways that are helpful. And so sometimes those ethical questions are about how we should balance various values that are in tension with each other. So to take some examples that are probably topical for most folks, given our experience the last 2.5 years with COVID, how do we weigh the known benefits of having loved ones support patients in hospital against the need for infection control, whether that be during a pandemic or even during a more localized disease outbreak? Similarly, should protecting vulnerable individuals take priority over individual autonomy rights when you're developing policy or processes around vaccination status? And so in these sorts of cases, the role that I take is to help explicitly name the values, because values are always there, whether we name them or not. And so my argument is generally that things go better when we surface the values, when we've named them, and then can ask the question, are these the values that we want to carry us forward in the situation? We also look at contextual features and really think about how does this particular situation affect how values play out in practice, and really being sensitive to context. I feel like that's certainly a strength often that social workers bring to ethics consults, is that they are extremely good at identifying those relevant pieces of context that make this situation different from another one that might on the surface look similar. And then once we've, having identified all the values, really look at recommendations for actions that reflect those values, and generally a range of recommendations that are a different balancing of the values that are in question, but that are all justifiable at the end. So again, it's not about finding the one right answer, but what balance of values fits, again, within the context of other ways that we balance similar sorts of values in these situations. So, and again, those sorts of scenarios where it's sort of a specific question about what do we do, I think are where ethics is most commonly brought in. But other times the concerns aren't about what we should do or which values matter, but they're instead about how we live out those values in practice as individuals and organizations. So I often say I have the easy job in ethics a lot of the time of doing that identification and analysis and balancing of values. But the really hard work, which is done by folks like yourselves and other folks who are working within healthcare systems every day, is figuring out how we actually do the things that we've decided we should do in practice in a context where money, time, and people are in very limited supply, and the demands can often seem limitless. And again, that's the hard piece, and that's often where we'll get a request that comes in that's more about that sort of situation, and those are more challenging situations for us, because as ethics support, there aren't levers that we have access to in order to change that system. Although something that we do often do is name that moral distress that is being experienced, and sort of validate that experience, that there's not something wrong with you as a healthcare provider, you're just trying to practice in an impossible situation. And I certainly think that that sort of support can be valuable as well, but it doesn't necessarily lead to a course of action that's different at the end of the day. It's more about how do we manage some of the ethical challenges that are just inherent to that work context. But sometimes there's also questions where there are concerns about how a healthcare provider has made decisions, or how they've treated a patient or their loved ones. And these are the sorts of cases where we say, actually, that's a question for the regulator for that healthcare profession. And so this is why it's exciting for me to be able to do this conversation in collaboration, because there have been opportunities that we've had to do some remediation for other regulators, and really get at that. What is the role of ethics support? And then what is the role of ethics from the regulator? And again, how do the various colleges help support their members, again, in a sort of proactive versus a reactive mode? And am I going on too long? I'm sorry, despite my notes. We're okay? Okay.
You're doing great. I'm excited for you to be explaining more about your role in our collaboration, and then we'll jump into our example.
Perfect. That sounds good. All right. So we've come to the part where I explain how I've got here today. And so, over my career, we've engaged with social workers within Nova Scotia Health and at IWK Health from time to time, including around documentation, questions around recommending continuing care facilities, as well as some of the ethical challenges that are unique to social work practice. And again, often it's social work who is the person who reaches out to contact ethics support. And I find often too, when I get a consult in, one of my first questions is, have we contacted social work as part of this? And most of the time the answer is yes. Sometimes people are like, no. And then that's often the first step sort of forward for us. So there's a lot of collaboration in terms of that clinical work that we're doing with social work already. But in terms of today specifically, I was participating in a panel discussion along with N back in the winter for social work at IWK Health. And so N mentioned that the college was working on the ethics consult process and was wondering if I had any thoughts or insight that I might be able to provide. And so N and Lauren and I had been sort of meeting and chatting. And then one of the things that came out of those conversations, again, with that sort of proactive, preventive focus that I think is wonderful that the college has. We thought that having these conversations was a really good way to, again, sort of provide that upstream ethics support for folks. And so here we are today. So I've been doing this long enough to know that, again, the conversation around the cases is where it's really going to be at, and that's going to stick with you. So I will turn it over to N to bring the case to us and look forward to that conversation.
Thank you so much. Yes, so we are wanting to really talk a little bit about one case scenario that has come up for us, but this is, as you can tell, the beginning of a much longer relationship where hopefully we can be working with all of you when you identify ethical concerns to help direct your ethical concerns to the right place and then work on advocacy. And that's actually one of the areas that we have been adding into our current ethics consultation process, is how does advocacy help us ensure ethics when our current guidelines, be they professional for social workers or broadly, are not yet clarified. So the question that we want to be talking about is, and I'm going to have Alex speak first, and I'm going to have Marika speak second, and then Lauren is going to sort of like help us begin to think about how do we differentiate. Oops. Okay, I'm going to do this all over again. There we go. And now we've got our little cafe. So the question is, what happens when, actually, maybe we'll have Lauren start off first, but what happens when somebody calls the college and says, okay, we have a concern about a colleague. So I'm going to, just in case you were wondering who I was, I'm going to add myself to this conversation for a sec. So someone calls, and we've heard this a couple of times. I complete my professional development, but I know somebody who is not completing their professional development. I have a colleague that is submitting false information as part of their registration and renewal process, saying that they attended a professional development event that they did not. What do I, social worker, do in that context? So that issue could be a social worker, it could be a non-social worker. Maybe you're aware of an ethical concern with your colleague who's a social worker, or an ethical concern with your colleague that's not. So Lauren is really going to maybe talk through how do we make that distinction. But I'd like Alec to talk a little bit about what social workers should do if it's a social work concern. And then Marika is going to talk a little bit about what you should do, what social workers should do if it's, let's say, a doctor or someone else who's not a social worker, because those are different questions, but they all come down to a similar issue. Lauren, I know I just put you on the spot. You weren't going to even speak. Do you have any comments that you want to say before I add?
No, that's okay. Why don't you start with Alec and Marika?
Sounds great. We will come back to you as your closing comments. That sounds perfect.
Yeah, I mean, if you wanted,
Okay.
like, if you wanted to overview too, like what that process is now.
No, yeah, I was just being spontaneous. Sorry.
No, that's fine. Yeah.
All right, Alec.
Yeah, thanks, Anne, for the question. And I think that this applies, Anne's given us a very specific example, but this can apply in a lot of areas, right? What happens when, we're working on a team, and a member of the team isn't perhaps fulfilling or living up to the ethical obligations of their particular profession? What is our role, and what should we do? And I usually, whenever I get an ethical call, start with the premise of, I'm not going to give you an answer. So this conversation might be frustrating, but bear with me for a minute. Because generally what the process is as Marika laid out too, is about looking at all of the competing conflicts, looking at the competing values, and understanding the context, and being able to work both with yourself and your team to come up with, and I'm sure Marika uses this language as well, but what is the least harmful decision that I can make in this regards? Because ultimately there's never a perfect decision. There's never a perfect outcome. From a regulatory standpoint, and I will add this as well, if a complaint is issued to the college, what the complaints committee, again, who are all social workers themselves with public members in there as well, are looking at what was your decision-making process. That is the primary mode of investigation. How did you arrive at this decision? So with the example that Anne has given us here, what of course it resolves in is what are the competing values here? What are the competing interests? What is the pathway forward? Ultimately, social work knows very well that our work and the effectiveness of our work is rooted in our capacity to form relationships and to hold those relationships meaningfully towards individual, community, or macro level change. Those are the pieces that, again, are really foundational. So in a situation where you have come across a colleague who, in Anne's example, has not been completing their professional development and has been, putting entries into the renewal portal to be able to renew falsely, and you learn about this, what is your initial response? Well, I always start with the question is, what is your relationship with this person? What does that look like? Are you in a position where you can have an honest and open conversation with them about your concerns, what that represents, what it means? What are the values of the profession here? Certainly one of our foundational ones is a commitment to lifelong learning and growth as a professional. So again, there's lots of stress on people's lives. We recognize that 40 hours of professional development is a standard that's set by the members of the profession as again a quantifiable commitment to that lifelong learning value. That is a reasonable amount of hours to be able to effectively grow as a professional, to nurture yourself, and to learn best new practices. So when someone's not achieving that, of course, understanding your relationship first, your power within that relationship to influence change, and what the outcome is you're looking to achieve. Now, again, there are maybe barriers to that professional development learning that could be addressed. There could be ways to be able to support someone in achieving it. And the question, of course, is what's the harm that's going to be caused by somebody not completing that professional development in this situation, or not honoring, our ethics or our values, or working towards that, and doing a good assessment of that. Now, somebody who maybe not completing their professional development over 1 year, okay, maybe the harm is little. But over time, if somebody's not learning or growing or developing, that can create and put people, particularly receiving services, in a place of harm. So what is your individual ethical obligation to resolve that? Working on teams is incredibly important, and recognizing that you are not alone is incredibly important. So I don't think a social worker should ever feel like they are alone in a situation. If you are alone on your team, that is the role that the college tries to fill as well, to reach out so that we are able to provide you some support or walk through some of these challenges. In this context, talking to supervisors, other colleagues, gaining input is part of that process. Ultimately, again, there could be a role for the employer. There is a role for the regulator if behavior and if conduct is continuing to not change. Now, those are more, of course, like any situation, as risk elevates, you have to choose what parameter you're going to go down and which way you're going to focus. Ultimately, if the college does get involved, our primary purpose and lens, again, is safety. That's what the decisions are made on, and process. So how did we arrive at these decisions? How are we ensuring safety? And what can we do to work with individuals to ensure that that safety is there? And so, that would be the message I have, is understanding your relationship, understanding your power, having those courageous conversations, working with your team, assessing that risk, and elevating if you need to. I'm happy to turn it over to Marika, who can probably add some more layers to that.
I mean, I don't have a ton more, again, because even if it was a colleague who was not a social worker, I'd argue, again, from the ethics perspective, the same sort of process is going to imply that really is, start with curiosity and recognize, the fact that none of us imagine ourselves as mustache twirling villains in our lives, and so what does it look like in that person's shoes? And again, really understanding the circumstances. So it used to drive the former dean of medicine at Dow nuts when he'd ask ethics questions and the answer would be it depends. And he used to tell that, like, all the ethicists, I've asked them all and they all tell me it depends. It's like he thought we were just holding out on him, all of us, instead of that being actually the answer in a lot of these situations. So again, if it's a colleague who's a social worker, even if it's a colleague who's not, again, trying to resolve it with, if we think of sort of the public health intervention ladder with sort of the least restrictive means or the least relationship harming means possible, that does live up to those obligations that any member of a healthcare profession has to the public. And so again, whether that's a member of your own profession or another healthcare profession, similar obligations to the public in terms of how all the colleges work as regulators. And so there's not something that is going to be significantly different. Again, recognizing that your familiarity perhaps with the way that different colleges operate might not be the same with a social work colleague versus another, but the general approach that you're going to take to the situation is going to be similar. So Lauren, do you want to round it out with a cleanup hit on this, or anything else that we've missed?
No, I was just furiously taking notes for you both. I mean, you've hit on a lot of the same topics. So like Alex, starting with curiosity. What is your relationship? What are the competing conflicts? And I think you both said this in different ways, but what do we think we know and what is actually going on? Those may be the same thing and they might be a little different. And what do we know from the values of our profession, from their profession, if it's a different profession? What is the harm going to be? How do we maintain those relationships while also upholding our obligation to our own, like what we owe the public according to our obligations as a social worker in this case, and then assessing risk and elevating if you need. And you both kind of said this, but this would be my wording, but what is the plan, right? Within that relationship that you have with that coworker? Because as Alex said, teams are super important. Working with teams are incredibly important. And if there is already that feeling of isolation, wanting to make sure in your team, then wanting to make sure that the college can assist in, being that buffer, but also how does that repair happen in the team that you're working in outside of the college?
And just to pick up on that team piece, in my experience with doing ethics consults, often there'll be something, an elephant in the room that's about the team, or it's about an entirely different case that hasn't been resolved. And so I would, in my experience, bringing it out, having those difficult but courageous conversations as a team, addressing concerns, giving everyone involved an opportunity to describe situations from their perspective, leads to better functioning overall. At the end of the day, that sort of ignoring it doesn't make it go away, as again we know in many realms of healthcare practice. And so I really wanted to emphasize that piece, as well as the, again, how do we know where are we making assumptions, and really sort of double checking. And sometimes there is very genuine dishonesty going on. It's that does happen, but I've also seen cases where assumptions are quickly made, and then get a life of their own, and that can also be quite damaging again. And so really wanting to again be open and clear and honest and have those good conversations is going to be the foundation of moving forward in a way that really does support everyone and leads to the best possible outcome, which might not be the best outcome, but again, given the situation, it might be the least worst. But that's, as Alex said, sometimes what we're going for.
Yeah, I would just add to again, it's the importance of those relationships, and being able to, as Marika and Lauren have emphasized, come at this from a curiosity lens, not an assumption lens, is really crucial to understanding that. And again, I do like, again, the emphasis that you're not alone. There are folks out there who can help you walk through these processes. And again, to the last point that Marika made as well, if it does reach a point where, again, behavior, conduct, attitudes are not effectively being changed, then ultimately both the employer or the regulator may need to get involved in some capacity. And again, folks are around to be able to help guide you as to when that might be the case. Okay, I think that N has moved on. N has a very busy day today, and top of organizing this event, they were organizing another event with Dal again. So I know they've gone off to do that. I know we've got the meeting booked for another 6 minutes or so, but I do want to just give some space now, because we've provided, again, an engagement and some conversation for any kind of questions, comments, concerns. If you want to identify yourself in the, they have a question in the chat. We've just got some safety controls on. I think we have to unmute you at this point in time. So if you want to indicate if you have a question, we're happy to monitor that now. We'll give it a few minutes. I'll monitor the chat. What I will say while I see hands up. Sorry.
Hands raised.
I was looking at the chat and I wasn't looking at hands. My apologies. Glenda, I'm going to come to you first. I think if I ask you to unmute, you should be able to.
Hi.
Hi, Glenda.
Hi, can you hear me?
We can.
Oh, good. Yes, I just want to share sincerely my appreciation over the years when I've consulted with the college around some extremely challenging ethical dilemmas on lots of levels. I've always had such helpful response, and it's like there to help you, has been my experience. And like today, even listening as you're sharing, and then coming from this place of curiosity and stepping back into presence and looking in a 180-degree way. It helped me even today in that I have this ethical dilemma situation involving an individual I'm working with and their parent. And then I just realized, oh, okay, no wonder I've been struggling. There's ethical dilemmas more than I was realizing in this situation. So it's just sparking constantly, like, okay, what are the ethical dilemmas then? And I found over the years with my team too, when I've been in a leadership role, I'll just say, okay, let's step back and look at the ethical. If we're struggling, it's because there's likely different ethics involved that are competing. And one of the big ones has been that moral distress one, when you don't have the resources that you need and to the demand or the need, the true need, and then there's no perfect solution. I found that very helpful when you shared that today as well. So I appreciate that. And I'm curious, the situation that you presented, is there truly a way to ensure that everyone does complete all of their professional development? Probably not 100%, but it's the showing, it's showing that every effort is being taken to support folks to do that and to ensure folks do that. That's what I'm appreciating. So thank you. This is mostly comments and appreciation from me.
You know what, Glenda, I'm happy to receive those. Also, I know Glenda is one of the people who will call, and I probably irritate her by saying, I'm not going to solve your problem for you, but I'm here to help you walk through it. And certainly we have some good conversations around that. So thanks for those comments. Dom, I see that your hand's up, so I'm happy to hear from you. And then I do see a couple comments. And if folks do need to leave, feel free to. I'm happy to stay on until all questions are exhausted, as it were. So Dom, go for it. Oh, I think I have to ask you to unmute. Hold on. There you go.
Thank you. I was concerned more around the issue of power and hierarchy. If I have an ethical issue regarding how my boss or supervisor is behaving, it gets pretty complicated. And so I just thought I'd mention that our processes for handling these kinds of things need to recognize those power relationships.
Yeah, thanks for that, Dom. That is always crucial and something that social work is always paying attention to, whether, again, it's a power dynamic where the social worker has power over a client or vice versa, where there are supervisors who may be at play. This is, again, why that team approach is important. I think that, the messages that were delivered here are the same for whether you're dealing with a supervisor, a client, or a colleague, is that, again, relationships, curiosity, good questions, no assumptions and judgments are really important in how you engage in those conversations. But of course, and I know there's a question that I'm really interested in talking about too, in terms of and Marika outlined this as well, is that certainly in social work practice, I know in other areas of practice, that there's a constant tension and struggle between what the values of our profession call us to do, which of course is the promotion of social justice, the achievement of human rights, creation of an egalitarian society in the context of a neoliberal state that is consistently asking us to do the opposite in many ways. And that is a consistent and constant struggle in terms of how do we ethically operate in this context. And it comes back to, again, to many of the narratives that we've talked about, least harm, figuring out the best possible outcome. But that is also where a collective voice plays a role as well. Is that we as a collective of social workers do have the ability, the power, and a voice to advocate for core systemic change in some of these areas. For instance, again, Lauren and Anne and their team have been working on guidelines regarding documentation. Documentation has become a bit of a hot topic issue in this province for a number of reasons. One, because many of our systems have kind of changed their processes in terms of how documentation is meant to be done and taken. And again, some of those changes, it didn't feel like there was consultation with the professions delivering them. So certainly in that health authority right now, with the access of clients, particularly in mental health, to their written documentation from a social work perspective, again, as we're conscious of power, self-determination, empowerment, we fundamentally recognize that documentation is power, and that clients should and must have access to their documentation and what's written within it as a way to, again, empower them to make decisions on their own life. We've got a system change that has started to impede what is an ethical priority of social work. So how do we address that? Social workers have raised it internally. The challenges, the management, they've engaged it with us. We're clarifying it in terms of our expectations, in terms of guidelines. And then we also have the ability to advocate for what is good ethical practice. So I've gone on a long time here, and I apologize for that, but there's some interesting angles here. And I think that, again, that power dynamic, yes, is crucial. The understanding your role and coming at it from those same principles we talked about. I'm happy to hand it over to my colleagues to add on to any of that.
Yeah, I think that attentiveness to power dynamics and how they can affect the ethics conversation is certainly something that when we're looking at going into an ethics consult, that we're trying to structure the conversation in ways that hopefully minimize some of those power dynamics, recognizing that healthcare is, as a whole, still quite hierarchical, and that does affect sort of whose values often carry the day. And when we think again in terms of some of the tensions between professional values, where there's certainly, of course, a core of commonality across healthcare professions, but there's also differences in emphases. And again, particularly with the movement toward the anti-oppressive framework within social work, that sort of move is not necessarily matched in other healthcare professions. And so, I anticipate that there may be some tensions that arise. So in terms of when I'm approaching a consult, really try and be aware of what those dynamics are. But one of the benefits of the way that we've structured ethics support in Nova Scotia is that there are folks within Nova Scotia Health who participate as ethics consultants, but my colleagues and I on the ethics collaborations are external. And so we're able to go in, and we don't have a pre-established place within that hierarchy, and that can help us in terms of just the questions that we can ask. We can ask the naive seeming question that needs to come out, sort of thing. And we also don't have the accountability directly to folks within the organization, which is not the case for ethics consultants across the board. So one of the things that does come up for ethics consultants as a profession, and we're working on processes of professionalization, and that's a whole other kettle of fish that I'd love to chat about at some point. But the questions there around, if you're employed by an organization, how does that potentially limit your ability to be effective in the role of providing ethics support? So again, it's something that we are sensitive to, and again try and minimize the effect, recognizing that completely flattening it out isn't something that we're able to do.
Lauren, anything you wanted to add?
No, you both covered brilliantly. I just saw there was one other note in the chat. Hi, I'm Jan, healthcare social work. I'm noticing an increasing pressure from care teams to turn to social work to solve housing issues for homeless inpatients. This presents a challenge.
Yeah, I mean, this comes back to that tension. I think that exists in many practice. It's particularly prominent in social work. Housing is the issue currently. It's always been. We recognize that housing is health, and that housing ought to be a human right. And so this is where, again, when we're dealing with ethical issues, it's important to be able to identify, well, where does this lie, right? Is this, a micro level, macro level, meso level issue? Who do I work on this with? The expectation on social workers is always a challenge. Tanya Grant, who I know many folks know, who is the longtime professional practice lead at the IWK, always talks about, particularly in that role, that it's most of the time she was spent trying to explain what social workers did in the hospital setting, and then recognizing that whenever anything was not in the ordinary, that the social worker was there to resolve or solve that problem, which again is an unrealistic expectation of social workers to be able to solve the housing situation in Nova Scotia. You know, as a collective, we are trying. The college has worked very closely with Lauren's organization, the Canadian Centre for Policy Alternatives, to put forward a very reasonable financial and holistic plan on how we can resolve housing in Nova Scotia. That same group of advocates was in the Red Room at Law Amendments Committee last week, again, trying to educate the government on, you know, the real issues that face housing. And Jan, like we've explained again, that this isn't just about the folks who are experiencing housing issues. You know, primarily this is what it's about, but it impacts so many areas of service. And so that macro level ethical dilemmas, you know, that is a role for us as both a professional association and regulatory body to really try and influence and push, and working with your colleagues and your peers to continue to push that public narrative to, you know, change public perception and policy is certainly a part of this. And again, the narrative there is that you cannot do that alone. We cannot solve macro level, unless you're the premier. You cannot solve macro level issues with the swipe of a pen. That it does take a collective approach to do so.
And I think with those sorts of questions, I mean, I certainly recognize that phenomenon is something we've seen in ethics consults as well, that we've sort of, you know, it's challenging for a number of reasons, including housing and, you know, ethics. Again, that's, well, they can't make it worse. Hopefully they'll have something helpful sort of thing. And I think part of the discussion when I go into those is about what is it reasonable for healthcare providers to expect of themselves and of their colleagues. And there's a phrase that, you know, ought implies can. So if it's something you can't do, then you don't have that ought or the moral obligation. And so remembering that, and that's something certainly that came up during COVID a number of times as well. And so dealing with some of that concern that came from providers feeling like they weren't living up to the ideals of their profession, again, through no fault of their own, but, you know, due to that broader context in which they're working, and which, you know, it was not even the premier could make COVID go away with a wipe of the pen sort of thing. And so I think acknowledging sort of the reasonable limits of what you can do in those situations, and certainly that collective action piece that Alec was mentioning is a part of it. And so that's where that sort of obligation goes. But, you know, it's also fair, you know, to sort of push back against those expectations and say, you know, look, this problem is bigger than this particular patient or client. You know, bigger than us as a team. And sometimes in those ethics conversations as well, it's about, you know, you guys are all doing the best you can with what you have. Again, the best possible option can still feel really bad. And that's the sort of discussion that we often have around those. And so, you know, without diminishing the scope of the problem, and that we all have an obligation to act on it, that it nonetheless shouldn't land entirely on one member of the team. And again, you know, social workers can do a lot of magic. You know, I sort of see them as the MacGyvers of the healthcare team, to date myself in terms of pop culture references. But again, you know, not miracle workers, nor should you expect yourselves to be, in order to, again, feel that you're practicing with integrity.
I always think about it as like, how am I like ethically trespassing on myself? So often it's that focus on like the upholding the standards. And if there's an ethical query, sometimes it's always, you know, there's a focus outward, but sometimes too, it's like, okay, where am I ethically trespassing on myself? How am I taking on being the solution for a macro level problem, as Alec described in this particular instance with the person in front of me. And it doesn't, like you said, it doesn't mean it's going to feel good. It doesn't mean you can't hold those really strong, upsetting emotions and, frustration, like energized to do better, but also like, where am I holding myself to this, an ethical standard that's not actually achievable in the case of something like a macro level change that's needed in the now.
Yeah. Lauren, can you, just because it's an important concept and I think it probably needs a little more definition for folks who may not have heard it before, but can you just expand on what you mean by ethical trespass a little bit? Sorry, not to put you on the spot. I think you're on mute again.
So what I mean by ethical trespass, it's I mean, like in the colloquial way, it's basically like lying to yourself. That's the way that I think about it in the day-to-day, in the non-academic setting, right? So we basically have convinced ourselves that we can create a solution, and not only that we can create a solution, but that we are bound by our morals to create that solution. And if we don't, then we are like not only failing ourselves, but failing a profession. And so that's kind of where I like to use really like baseline terms. So that's why I use the word lying to yourself, because the college isn't asking, like, if we go back to, okay, what are like the things I wrote down? So what is the relationship? Starting with curiosity. Okay, what are we at? What is the college actually asking us to do? That's not what the college is asking us to do to uphold our professions. So yeah, so an ethical trespass, again, like from the language, it's like you're walking over a line in the sand, and it's just trying to figure out which line you're on.
Oh, I appreciate that. And Marika was talking too about moral distress, right? And so these are connected issues that, particularly as a profession that is bearing witness to suffering on a minute-by-minute basis, holding these concepts and having a good understanding of them is really important to yourselves, as well as to how we deliver services. Because again, the consistent nature of unaddressed ethical trespass, where you're consistently just taking actions that are you're justifying in a way, but are pushing against your moral values, leads to the more significant outcome of moral distress, which is of course rooted in vicarious trauma and has significant outcomes in terms of your own mental health and well-being, how you practice social work in particular. Many of you know that I've delivered ethical workshops for the last 5 years, and one of the concepts I talk about a lot is that tragic gap that social workers need to consistently find themselves in to mitigate some of that ethical trespass, where our values give us a set of ideals that we certainly want to hold on to and strive to, but if we cling too closely to them, we risk becoming irrelevant idealists, where again, those ideals are never going to be actualized because we're not grounding them or meeting the systems or the people or the folks where they're at. On the other side of that, if we're consistently ethically trespassing on ourselves, if we're leading to that moral distress, then we become corrosive cynics, in which, again, our ability to change the system or meet clients where they are at, or be able to, walk forward in a healthy, meaningful way are significantly compromised. And so the context of, modern day social work practice, in order to, I think, survive, thrive, and deliver ethical services, is about finding that tragic gap in between, being an irrelevant idealist and a corrosive cynic. And it's tragic because, again, that tension is always pulling you in one direction or the other.
And I'll just say for Hannah Arendt, if I'm pronouncing their name properly, is the person who coined the ethical trespass term, and Dr. Merlinda Weinberg has done some coalition of writings on that and work on that. So I can plunk some things in the chat too.
think the one thing I just wanted to pick up on there as well from Alec is that, that we aren't alone in dealing with this. And I think often there's a sense that you are, or that I'm the only one feeling this way. And so I think, recognizing the supports that are there, again, whether that's reaching out as a team for ethics support, so you can just have a conversation about what everyone's thinking or feeling, but no one is saying or feels they have time to address, or social work colleagues or the college and all the work, again, that it's doing to really be supportive, and that opportunity to share and to come together in community can be invaluable as a way to, again, mitigate the harmful effects of experiencing the moral distress. It might not make the moral distress go away, but it does share the burden out. And again, it helps to recognize and externalize to a certain degree that this is an impossible situation that we're all in, and like say, finding that tragic gap and learning how other people are doing that, balancing act that enables you to still be alive to the ethical concerns that exist in your practice without being overwhelmed by them. So I have a colleague out in BC who talks about moral resilience, and again, that's not that you're able to be like la la la, I don't care, everything's fine, but that you're still able to be aware of those moral challenges without becoming overwhelmed or deadened by them. And that, so even as it may be painful, it's still it's a good sign that you can still feel sort of thing. And we have a podcast on that if anyone is interested in that particular resource. There's a number of resources on the Nova Scotia Health Ethics Network, NSCSW.ca, which I'll stick in the chat, website that we've developed that may be of interest as well.
Excellent. Okay, I don't know that I saw any other questions. And we are 18 minutes over our time, but it was good questions and conversation. We are, as an organization, committed to continuing on with these ethical cafes. And Lauren and Anne and the professional standards team are going to be bringing to life an ethical consultation process soon, so that you don't just have to talk to me about your ethical problems. We can actually take a more team and a collective approach to resolving some of these issues. And Marika has clearly identified herself as a clear resource, particularly for folks working in the health authority or Nova Scotia Health, to be able to engage and reach out to. So I'm grateful that you've given some time to have this conversation during your lunch hour on a Friday, and hope that everyone has a really lovely and restful and restorative weekend. See ya.
Thanks, everyone. Bye.